Good morning, good afternoon. Thanks, Julia. Thanks to Delft for organizing this very important webinar. We're very happy as IOM to be part of this webinar. And today my topic is on introducing CAD AI in challenging operating environments. What lessons have we learned from the Middle East response? So the Middle East response is a global fund-supported project. It's a regional public health project being implemented in 6 countries, namely Iraq, Jordan, Lebanon, Palestine, Syria, and Yemen. And as you all very well know, or most of us very well know, that the Global Fund supports 3 diseases: malaria, HIV, and TB. And so my focus today is on the introduction of CAD AI for diagnosing or improving our TB screening. The presentation will touch on the overview of the project, the numbers that we have. I'll take you through the numbers that we have in terms of notification, which is informed why we have gone for CAD AI, the current challenges, and where we are at in terms of introducing this technology. I must point out that we are at the very beginning of introducing this technology to the project, and we are also learning. So at the moment, we do not have data yet, but however, we're in the process of setting up the software, linking up the hardware to the devices that we have, so that we can start reading images from this technology. Next slide, please. So quickly, the Middle East response, like I said, is a global fund supported project. We are now in phase 3 of the project, which started in 2022, ending in December 2024. And IOM is the principal recipient of the grant. What do we aim to achieve? We are aiming to ensure essential HIV, tuberculosis, and malaria services, prevention, diagnosis, and treatment are provided to refugees, IDPs, migrants, key affected and hard-to-reach populations. I have already mentioned the number of countries and identified the countries where we are in. And these countries are classified as, by the Global Fund, as challenging operating environment because of the difficulties in terms of access and basic implementation in those countries. Next slide. So again, this is also a quick slide to give you an idea of the countries we operate in. These are the countries in red, and the population sizes of each of the countries. We have over 100 million people in the 6 countries that we are in. And of course, we are targeting refugees, migrants in Jordan, Lebanon, and key populations in these countries. We have a 71 million budget for the 3 diseases, again, for this current phase of the project, 2022 to 2024. Next slide. Yeah, this slide takes you, gives you a snapshot of what we're talking about in terms of TB notification. And of interest here will be that if look at this closely, there is an overall cumulative increase in notification over the years. And this is in no small part due to the role of the project in increasing notification. And you'll see also quickly asterisks on Jordan and Lebanon. This is because these are only, previously we were recording refugees and migrant numbers only, excluding refugee populations. So this is, of course, has changed. And you'll see also in 2019, 2020, the drop in numbers. This is due to COVID. And Syria only there, which I've circled, had a positive percentage because the facilities remained open during COVID and there were no restrictions on movement. In Jordan and Lebanon, you also see that 2020-21 there was a drop in migrant numbers. Next slide. because of COVID. Particular interest here, I mean, this is data from the Global TB report. WHO used the slight difference in the numbers on this slide and the previous slide due to the reporting timeframes from the programs as well as for the WHO Global TB report. But again, the numbers show that we still have gaps to cover in terms of reaching to the estimated cases. Next slide. So 4 out of the 6 countries that we have are in elimination or pre-elimination phase. And what that means is we need to increase, countries have to increase coverage to achieve elimination. This is these slides that I'm sharing here to give you an idea or to focus us on why we have gone for CAD for TB in this project. Next slide. There are a number of cases attributable to the 5 risk factors for TB. So CAD for TB here, or CAD AI will be part of a more sensitive diagnostic pathway to early detection of tuberculosis, prioritizing populations more at risk for TB. I think this is self-explanatory, but this helps us zero in on areas where we need to find more cases and therefore deploy resources. So this informs our planning in terms of deployment of diagnostics machines as well as the CAD AI technology. Next slide. So operating in what I've already alluded to as a challenging operating environment, these are some of the challenges we are coming across: political and economic instability. We are also seeing limited stakeholder involvement, zero or to limited domestic funding for health services, limited skilled human resources. I think my colleague also pointed that out. Centralized TB services at government level, insufficient diagnostic facilities, digital X-rays, gene expert as well. But I must also point out that under the current Global Fund projects from the C19 budgets as well as the standard grants, we are bringing in quite a few portable X-ray devices, mobile X-ray vans, as well as digital X-ray machines. So that will also address the gaps that we currently have. Insufficient drug susceptibility testing. Next slide, please. So, having looked at the current situation we are in as the EMEA, we decided to go for CAD AI. So we then said, because of the resources that we had, we said we're going to implement this as a pilot, and then with informed by the data and figures from the pilot phase, we then expand. So because this was new technology, hitherto not available in the country, and perhaps data not available anywhere in the world, particularly in humanitarian settings, as to how this would work, we had to go into an intensive information gathering exercise, consultations with the donor stakeholders, vendors who are supplying this technology, to gather information on how we could be introduced this. So we needed as much information as we could get. And of particular interest here is that so big was the drive that we initiated this exercise during COVID, when there were restriction movement and face-to-face interactions. And so we had to organize webinars with various suppliers of this technology virtually, because we really wanted to have this going. So after all these consultations had been done, we now could be in a position to define specifications and also identify areas where we needed to set this up. So the pilot phase is being the pilot is being done in 4 countries at the moment: in Iraq, Jordan, Lebanon, and Syria. And why those countries is because we have digital X-ray devices there. And we said we could set up the technology on the 24 digital X-ray machines that we have: 16 in Iraq, 4 in Jordan, 2 in Lebanon, and 1 in Syria. The one in Syria is a mobile X-ray van. So, and after defining technical specifications, we then had to say, okay, of course, that included what criteria or what will be the type of technology that would work in our region. So we looked at issues like ability to be deployed and operate offline on image databases, option of online if needed, data backup systems, probability score, predefined probability score for preset for TB screening, and image output, defined method of annotation and abnormal X-ray chest X-ray image, including HIPMEG or acceptable box. And then we went out to do a request for proposals in fulfillment of our procurement guidelines. Bids analysis followed, and then we started shipping the products to the different countries that we targeted for the pilot. So now where we are at is mostly installation and training. And I must also point out that the winning bid came from Delft. And we're grateful to Delft for the support that they've given to us since we have awarded them this contract to supply the hardware for us to start using this technology in our program. Next slide, please. So the challenges thus far in terms of implementation, and like I said, we're just starting. Shipping challenges to Syria due to sanctions, we managed to overcome this. Of course, there are issues with respect to the movement of products into places like Syria because of the embargo that's on the country, but we did manage to ship the hardware into the country. We are seeing also compatibility issues with some digital X-ray systems. And for this, we are again working with different manufacturers of X-ray systems to ensure that the linking up of the X-ray devices and the software and hardware CAD for TB is works seamlessly. From stakeholders, we are also hearing that there are concerns regarding privacy and security by stakeholders. So there's also a little bit of discussions to be had on this to ensure that everyone has the understanding of what this is about and how data and patient information will be handled. There is, yes, of course, some reluctance, but this is attributable to maybe education, where we need to raise awareness, further awareness of this technology, the benefits of it, and how it will work in terms of improving our TB screening activities. Again, we're saying we're having challenges in terms of installation and training. In some instances, we feel that perhaps training could have